Let's start it off sexy. And all the ladies say, and all the ladies say, I think I like that. And all the ladies say, the champagne light. Where trouble is
Welcome, Dr. Dyson. Thank you for joining us on Champagne and Conversations.
Thank you for having me.
And I'm sorry, I know you can't share in the champagne because you're actually at your practice, but we'll make certain that you get your bottle.
Next time.
Yes, thank you so much. Ladies and gentlemen, I have Dr. Wanda Dyson, and she joins us from Washington, D.C. Her practice, Change for Wellness Life, is an amazing place to be if, in fact, you want to preserve the youthfulness, if you will. And we have her here today to talk to us about her craft and some quarantine ideas and some of the things that we see, Botox related and things of that nature that we see online, and just giving everyone some information in case it's something you're interested in. So with everything, Dr. Dyson, please tell us all about how you became this amazing facial expert.
Well, it was divine intervention, I'd say, because it wasn't my original intention.
Mm-hmm.
My residency was in internal medicine, but in 2004, I was trained by a French physician in a French technique called mesotherapy. And that had applications for facial rejuvenation, injections into fat to dissolve the fat, and treatment of cellulite. And I hadn't planned on learning the other techniques, but he showed me Botox and fillers. So as a result of him training me in those, I came back to DC. The training was in California. I came back to Washington, DC and tried to order Botox. And they said, oh, no, you can't be trained by a French physician. You have to go through their network. So I was actually trained in Botox by a plastic surgeon in Baltimore, Dr. Dean Kane. And I went to an aesthetic institute and trained in fillers. And since then, I can't tell you how many trainings I have done. I'm what you call an advanced or master injector. And I've been doing this for 16 years.
And I must ask you, I know that I shouldn't say the secrets, but I'll leave it this way. Ladies and gentlemen, I would like for you to kind of think about how old Dr. Dyson may be. And then we'll see if at some point between now and the end of the conversation, will she tell us? But that just tells you how amazing she is at her craft. And we are so excited to have you on. You have obviously a great practice, to say the least. And of course, for, reasons, as we know, doctors cannot disclose who they actually see, but she sees great people and she does amazing things. So as you mentioned, from Botox, and those are the things that we probably recognize the most, you do some other intricate practices as well, like the platelet. What is that?
That's platelet-rich plasma. And I draw your own blood, spin it down, and it has factors that are healing to the body and rejuvenate the body, makes the skin look healthy and glowing. I also use it for hair loss, and injections of platelet-rich plasma into the scalp can grow the hair back. There are many applications of PRP, but I also use umbilical stem cells, which come from a newborn baby's umbilical cord. You can use that for aesthetic purposes, and you can use that to regrow the hair. So I have a complete hair restoration program, and I have also non-surgical cosmetic procedures that I can make an individual look anywhere from 10 to 20 years younger than their age. Or what I have also noticed in my practice is I have some patients that over like the last 10 years, they haven't aged. So I can keep them where they are. So we can reverse aging, and we can also keep the person looking the same. over
Like a time
time.
capsule. That's amazing. Yes. And ladies and gentlemen, we do know that these services that she explained work. So with that, please tell us where you are. I did mention you're in Washington, D.C., but address, how to find you on the website, social media, all of that great stuff.
So the name of the practice is Change for Life Wellness and Aesthetics. We're located on Capitol Hill, that's 650 Pennsylvania Avenue Southeast, Suite 250, and the zip is 2003. The website is cflwellness.com. And I have patients that come from all over the US, from California, Richmond, New York, and I've even had patients reach out to me from as far away as South America.
Yes, amazing. And your social media?
I think it's Facebook at cflwellness.com, I believe.
cflwellness.com. You were cutting out just a little bit. Okay. And the same with your
Facebook.
Instagram. Okay.
I'll get it to you before this is over.
And I've tagged her on my Champagne and V as well, so you all can find it if in fact you want to slide in her DM and ask her some questions or schedule an appointment. And with that being said, you know, I've been talking to you a little bit about just adding the injections to the lips, and I haven't gotten enough courage to do that. I've been looking at it for several years, but I saw on actually an interview that they were doing a Russian lip. Did you see when I sent you that?
I did see what you sent. I'm not familiar with that title, so to speak, but I can make people's lips look like that.
Yes, yes. I've just been obsessed with the whole lip situation, guys. So I've been asking about that. That service among some other ones, but yes,
I did a little to my lips about almost a month ago, because I was doing a television interview and I wanted to look a little perky. So
what did you do? What kind of service did you do?
Just defined the lip, the upper lip, more definition, and a little bit of volume. And as we get older, which you'll tell people soon how old I am, as we get older, we lose the corners of the lips, and I just kind of gave back some more fullness in those areas.
So would you say that this is in essence an art, obviously, and just the redesign, reconstruction, configuration, if you will? Is that really what you would define it as?
I definitely would say it's an art, and I didn't realize I had this talent. And as I told you, it's like by chance, or you could call it divine intervention, how I got into doing this. And once I got into doing it, I realized I had a natural talent. And I was doing a training with a plastic surgeon. He doesn't mind me saying his name, Dr. James Benjamin.
Okay.
He had a training at his office. And when he saw me inject, he said he was not going to do it anymore, that he was just going to stick straight to surgery and refer all his patients to me for injectables. Nice. And he said, I can put him on paper, I can write it on my website, that he feels I'm the best injector in the DMV.
And you cut out just a little bit in that part, but she said the best injector in the DMV, just in case you all missed that. We're not going to let the, you know what, do that to the internet right now. And in that, you have written a book. Talk to us about the book that you took a little bit of time to write the book. And I guess now going through the COVID allowed for you to finish it up. So that's great. Congratulations on that part. But in detail, what was your motivation for writing the book, and what does it talk about? Oh, of course, the title of the book, so that everyone can find that.
So my motto of my practice is inner health, outer beauty. So I have two sides to the practice. I wear two hats. So I would consider myself to be an artist and a scientist. So about 4 years ago, I was asked to be a speaker at a wellness conference. And she had the concept that she wanted different doctors, Dr. Exercise, Dr. Nutrition, and Dr. Mental, and she wanted Dr. Sleep. She didn't have anybody to fill that slot. So I was referred to her for that. And I began to do research on sleep in order to do the lecture. And I was like shocked at the impact of sleep on health and everything else, even
Sure.
beauty. Because
Sure.
if you don't get enough sleep, it ages you faster. So as a result of that, I began to do research, which took 3 years of research to write the book. And unfortunately, it came to print during social isolation and the shutdown of COVID-19.
Love it.
So I was not able to have a book launch or book signing or anything of that nature. So I'm doing it with social media. I'm going to be on television, national television will be on prime time, like CNN, MSNBC, and OWN Network. That's coming up.
Yay. Yay.
So I'm
Congratulations on that.
having to do it in a different way.
Absolutely.
Thank you.
That is what it's about. It's just changing the narrative. It's okay. It still came out. It has the same message and it'll get out to whom it needs to get to. I'm sure of that. Now, in regards to the title of the book, did you tell us that so that we know where to actually go and find it?
Okay. The title of the book is called How to Be Healthy. It's Not What You Think, because most people think that diet and exercise are the key to health. And they are omitting a very key essential part, which is sleep. And it impacts so many different things, like it can contribute to cancer, heart disease, high blood pressure, obesity, dementia, many things that we don't realize are connected to lack of sleep. So that's why I wrote the book, and it's from a different perspective. It's very simple. Its language is different, simpler and easier to understand.
How to Be Healthy Is Not What You Think by Dr. Wanda Dyson, in case she cut out a little bit and you all didn't get that title. Now, just going back a minute into the services that you offer, a lot of us have been in quarantine, as we just talked about, and holidays are coming, and people might want a little bit of pick-me-up, a little bit of rejuvenation. So as it relates to the services, and guys, we know that there are a lot of different doctors out that do Botox, Juvederm, do all those different services, but traditionally, what are costs like for these type of services?
Well, the costs are based on the individual and their needs. So as we age, we need more fillers, for instance. So the rule of thumb is it's 1 syringe per decade of life. So if you're 40, that's about 4 syringes. If you're 50, that's about 5.
And each syringe costs about how much?
I would say anywhere from 600 to 1,000. It depends on the fillers, and some fillers last 6 months, some fillers last 2 years, and then I inject a filler called Bellafill, which is a collagen filler, and it lasts up to 5 years. So it kind of depends on the type of filler and also how much the individual needs.
Okay. Okay. So, and then in terms of Botox, because that's usually a little bit more of a quick procedure in terms of, just applications and that. What is that? Because I know that I've heard some of my friends say, well, some people charge, $8 a syringe or $10 a syringe. I couldn't remember exactly what the prices are. So if you could kind of share that with us as well.
So again, it's based on the individual's needs.
Okay.
And I would say most women need about 20 units of Botox, like for this area between the brow, what they call the 11s. But there are some women in my practice that need much more. They could need 80 to 100 units.
Wow.
So in some practices, they charge by the area, regardless of how much you get. If you got 5 units or if you got 80, you would pay the same amount. I charge by the amount that the individual uses.
Okay.
So it could be as low as 15 units on average and as much as 100 units. And I charge currently $11 a unit, which is probably on the lower end of cost for Botox.
Okay. Okay. And are those usually the I guess the services that most people tend to get when they coming in for touch-ups and such?
I would say they get fillers and Botox the most.
Okay.
That's the most that most people want, but now they're getting keen on doing like platelet-rich plasma and other procedures that I do in the practice.
And speaking of other procedures that you do in the practice, you have another one that I'm sure is one that people are interested in, and that's the injections in the butt.
Oh, yes. So
Yes.
I do Sculptra injections into the butt for butt enhancement. And that's really good for people who maybe they're very small, they don't have much body fat. They've already maybe done all the lipo that they can do. They have no fat left, but they want to enhance the butt. So I use Sculptra to enhance that area. The amount, again, depends on the individual and how severe it is or how full they might want to be. I can shoot you some pictures of that later.
Yes.
But I've done even individuals who are making the transition from male to female.
Okay.
And they've already had the Brazilian butt lift and it didn't work. They're not as full or not as smooth as they like to be.
Okay.
And I would say my oldest patient that gets it is a female who's 65. And that's because she was losing volume and having some dimpling in that area. She's very pleased with the result and thinking about going to Brazil so she can wear a thong.
She was ready. I love it. I love it. So, but not to get away from it, because I know that we have, all kinds of viewers, and I don't want men to think that they can't use these services also. You do have a practice where you service a lot of men also for the Juvederm and the Botox and the filler as well, right?
I do.
Okay.
And I have one male in my practice who began when he was 47. He's now 60. And he actually looks younger than he did when he started. So like I said, I can reverse aging, but I can also stave it off, and you can stay where you are if you like to do that. I personally would like to do that.
Well, I think that you have been doing that. And again, I will not say exactly her age, guys, but she is over 50, let's say that. And she looks amazing. So just so you know, it is something that can be done. I don't know if I should say that it's safe, because obviously everyone has to take into consideration their own side effects, right? But ultimately, it's not bad. It's not bad to do.
I can say this, I've been doing it for 16 years. The main side effects of injections would be bruising and swelling. On a very rare occasion, a patient can have an allergic reaction, and that is swelling and redness.
Swelling and redness.
That has happened 3 times in 16 years. Allergic reaction, still come back and get the procedures again because they want the results, and I just pre-treat them with the steroid so that they don't get the reaction. So It's nothing that I have seen in 16 years, knock on wood, that has been life-threatening.
Yeah, and I will worry about that too as well, because I've just thought for years I've had sensitive skin and always been worried about what could actually be a reaction. But yeah, if you do have methods to counteract that, if you will, then I guess that is great. And then there's also some creams and such that you all recommend over the counter that you can use for bruising.
Yes, we use arnica, which you can pre-treat 2 to 3 days prior to getting the procedure. I also use arnica spray, which is in nanospheres that penetrates the skin while I'm doing the procedure, and ice also minimizes bruising. So we do all that we can to minimize the side effect of bruising. And if by chance it happens, concealer is your friend.
Yeah, you should have that there as well. That's a good idea. That's good. That's the next part of your business. So with that, If someone was having, photos done or something of that, how far in advance would you suggest that they get services in order to, have time to heal and all of that?
I would say to have time to heal and also to tweak it, at least 2 weeks. 30 days would be even better, but at
Oh, wow.
least 2 weeks.
Okay.
Yeah.
And when you say tweak, what does that entail?
So tweak might mean I want more somewhere. Because initially, say we do lips. So say we do the lips and they're initially a little bit of swelling, but then when they go down, you say, oh, I might need a little bit, on this side, a little bit more on the bottom or whatever. So then we can make those adjustments prior to the photo shoot or the television appearance or whatever.
Okay. All right. Well, that's good information. And then I guess if you are looking at, overall, and you don't have that amount of time, you can still do it within a smaller bracket of time. It's just like you say, may have to use more makeup, more concealer or whatever. If in fact, but
Exactly.
not everyone bruises, right?
Not everyone bruises. I can't predict when they will bruise or when they will not.
Right.
So that's why it's best to just have more lead time in doing it.
Right. And yeah.
And I don't mind telling my age. I'll be 66 next month.
Yay. And she looks great, guys. And so
I do this stuff myself.
Yes.
Of course. So I've done fillers, I've done my lips, I've have a little bit of Botox here, but I also attribute my slow aging process to compounded bioidentical hormone replacement therapy. I know that's a mouthful.
I was about to say, what is that?
That's a mouthful. But I replace my hormones.
Okay.
So, and I've been doing that for almost 16 years. So I believe that also slows the aging process. So we only have to age if we want to. I replace my hormones, my estrogen and progesterone. It's a cream that I use. I replace them. So when they get to be around 50, your hormones go away. And that accelerates the whole aging process. I began to replace my hormones around 50, and I've been doing so since then. So again, it's inner health and outer beauty. It's what we do on the inside that reflects on the outside. And then we get a little help from these procedures.
When I tell you all that I brought you the glow, I brought you the glow, okay? This is good information. Now, I know some would say, but it's so expensive, or it's probably something outside of my league or lifestyle or that kind of thing. But now, do you offer any kind of alternative payment plans, or does insurance accept any of this? I know they do for Botox if you're doing it for like migraines, I think.
Right, but they don't pay for cosmetic procedures because they don't feel that this is a necessity. Okay. This is a luxury. But also keep in mind, it's your face and it's the first thing that people see. And it can also help your self-esteem if you look a little bit younger, it just affects how you move in the world because you look younger and you feel younger. So you just have to decide what's important and what you value.
Your lifestyle, guys. That's what it's all about. Dr. Dyson, we definitely appreciate your time. We know that you had so many things going on, but you did take out a bit to spend with Champagne and Conversations to share more information. And please give us your website again, your location. And I'm certain that there will be some calls. People, don't be scared about it. It's not a painful situation. She'll walk you through it. One thing I did want to ask you before you go. Now, do people traditionally get any kind of like sedation at all, or you just kind of just weather through it? Is there anything like that?
I do a topical numbing cream. I can do nerve blocks, like if we're doing lips, because lips tend to be more sensitive. When I'm doing the Sculptra butt enhancement, I do sometimes give them some sedative like Valium or something like that so that they can be more relaxed while they're getting it.
Okay. Okay. Not just a shot of anything. We don't need that. You can just do just you'll give us some.
No, not
It's
in
not like a
general.
tattoo.
No, I had a patient today that was scared of needles, but she did great. You know, she was
Yeah.
a real trooper. She didn't get upset about it. She wasn't in any unusual amount of pain. And she was, you know, scared off initially, but she said I was very gentle. So she
Yeah.
was good.
That's nice. And the fact that you're thinking about the greater later. Like, I just can't wait to get to the results. So I'm just going to get through the pain. And of course, for those of us that have had children, I think that we could probably endure that part.
Right,
We can
right.
make it through. So with all of that, Dr. Wanda Dyson, guys, and please give us your website again.
Okay, and I need to tell them how to buy the book because it's not on Amazon.
Okay.
It's on my book website, and it's How to Be Healthy. It's not what you think.com. My other website for the practice is cflwellness.com. That's C as in cat, F as in Frank, L as in Larry, wellness.com. The office number is 202-575-4660, and we're located in DC on Capitol Hill.
Yay. Ladies and gentlemen, Dr. Wanda Dyson, and we appreciate you so, so much. I will make certain that we get your champagne so when you're off, you can enjoy it.
Thank you.
Cheers. Thank you so
Cheers
much.
to you.
All
Thank you
right.
for having me.
You're welcome. Thank you for coming.
All right.
Bye.